Congratulations to the Department of Emergency Medicine, Asian Hospital Medical Center for the 20th anniversary. My name is Dr. Eligio Santiago Villanueva Magirang, but I'm commonly known as Dr. Ellis, as one of the OGs of the attending physicians in the department. I started Black Saturday of 2022, and this is my first professional adventure or endeavor after my residency tenure in emergency medicine.
I joined the Asian Hospital and Medical Centers team in 2002. And the reason why I joined the institution was because of its state-of-the-art facilities and to be able to work with probably the best doctors in the country that will promote healthcare in the South.
I am Dr. Vilmore Tusing, emergency physician. My Asian story starts 20 years ago in July 2002. Starting to have a duty as an emergency physician shortly after the hospital opened its doors for accepting patients.
I was privileged enough to have this opportunity since Asian Hospital and Medical Center at that time was the first tertiary hospital that opened for that particular time, the last 37 years. So it was something exciting, it was something really new, and at the same time, a challenge. Because what makes it unique at this particular point in time is that I believe here, when we started, the ER attending physician was on his own. We were pioneering or setting up the actual practice of emergency medicine. We did not have any other associates, meaning to say residents or many other colleagues that would man the emergency department at that time. So that was the challenge, but then again, it became also the uniqueness of our department. The ER is manned by board-certified ER physicians, meaning to say they are consultants. They're done with their training program. So it was really very challenging, but at the same time, it is really what we train for in our residency training program. And by God's grace, up to this point in time, we have more colleagues, more progress in the work in terms of the emergency medicine practice. And that is my hope, that we get to improve further and get to be always at par with the standards of the practice of emergency medicine.
When the hospital was conceived by Dr. Garcia, the design, from its equipment, it was envisioned to be accredited by the Joint Commission. It was envisioned to be a hospital that would comply with international medical care standards. And as far as emergency medicine is concerned, we, I believe, contributed significantly to the advancement of the practice of emergency medicine in the Philippines. Among our ranks are heads of other various emergency departments today, previous and current board examiners, leaders in our specialty of emergency medicine. So it is the front door of the hospital, so we contribute a lot that way. Instilling community confidence in the care we provide as an institution.
One of the memorable things that the department has acquired during the past years during my chairmanship was winning the Asian Hospital Innovation Awards, which was given in Vietnam in 2019, which is optimizing ED flow at the ER.
I value harmonious relationship that was established within the clinical department as emergency department biggest achievement or accomplishment.
The biggest lesson I learned from Asian Hospital is learning its core values, which are fairness, integrity, teamwork, excellence, and respect. I think that this helped me as chair of the department and helped the department support the hospital's goal to achieve the best hospital in the country.
So I wish that the department in the last 20 years gets to have that continuous improvement on what is the latest from the clinical practice guidelines, standardization based on the local practice and the international practice. And hopefully that we get to be really the one of the ground zero for quality training in emergency medicine.
I hope that for the next 20 years, the good working relationship will be fostered together with its robust training program and dynamic management. I can foresee Asian Hospital with its ED to be continuously stride in the critical and emergency services given to the patients.
So in the next 20 years, we'll have a training program as well. There are many now in the Philippines, and the practice is growing. The demand for emergency physicians is growing. And I think that's the future.
The emergency department provided a vital role during the COVID-19 pandemic. In fact, they were the frontliners, and my gratitude to them for being there, because without them, it would have been very, very difficult for us, internal medicine, to handle these COVID patients. Did a very good job in facilitating, admitting, screening, and treating the patients, especially when there were no available rooms or the ICUs during the pandemic. I'd like to give my heartfelt thanks to the emergency medicine, their staff, the consultants, and the leadership have been very kind and caring of the patients who come in, that we see, especially when we see them in the wards already after the care and treatment that they have received at the emergency department. I do not know if our life here as internists and internal medicine would be like if we didn't have the people in the Department of Emergency Medicine. So I congratulate them for the past 20 years who have been with us in this institution, Asian Hospital, and I wish them all the best.
You know, emergency rooms have always been full ever since the pandemic started. But even before that, you could see that they're even fuller. And it's just that the kinds of patients that flock to the emergency room have changed dramatically over the past few years. And that in itself is suggestive of what the role of emergency medicine is nowadays. More than just treating the worried well or those with minor ailments. It's really become a flashpoint for severe disease in people who are really sick, either from COVID infections, but more importantly, non-COVID infections. So the role of emergency medicine has become critical as first responders to people with severe illness. And I appreciate the fact that our emergency medicine consultants have risen to that challenge in a valiant and triumphant way, redesigning and reinventing themselves and their processes so that they are more capable in caring for people who otherwise would have been readily admitted to the floors. Gawa ng COVID testing and all sorts of problems in admitting patients, the emergency room has become a small hospital. So that's not exactly what emergency medicine consultants are supposed to do, right? But as I've said, they've risen to the challenge. They've acquired more skills and, more importantly, a different mindset so that they can then take care of patients they've never taken care of before. For that, I truly admire them and I'm grateful. And I hope that they will be one with the hospital in still evolving the kind of acute care that our patients need. And that, I think, is still going to be a challenge in the future. But I'm very confident that our emergency medicine department and all its consultants will be able to address the challenge with the hospital and therefore assure better and safer care for our patients needing emergency treatment. Thank you.
Congratulations to the emergency room department on our 20th year anniversary. Your department is like New York City. They never sleep. You are there 24/7, 365 days in a year. Whether there is typhoon or calamity, you are always there to provide a service. You have done a great job in promoting a very good image of the hospital, being the front line of receiving patient that is acutely ill. And I would like to thank you for that. I'd like to thank all the emergency department staff, the nurses and the doctors, the past chairman like Dr. Danny Anastasio, Dr. Steve Almeida, Dr. Mark Reyes, and our current chair, Dr. Eden Lasala. I really thank you from the bottom of my heart. And on a personal note, this is really something that I really appreciate the emergency department. For the past 20 years, I've sent all my patients, my friends, relatives, my sisters, and even myself. We were all treated in the emergency department of Asian Hospital, and I'm telling you, I'm really very, very grateful. And some of this situation that we've been through the emergency room are really very life-saving and very gratifying. Congratulations to you all, and mabuhay kayong lahat.